It appears that IShowSpeed has been in the hospital in Japan, and this has really caused a lot of media attention as he is one of the most popular streamers. In this video, we're going to talk about what the potential cause of his pain and symptoms might be, and just a disclaimer, this is for educational purposes only, as you can never diagnose someone if you're not their actual healthcare provider. So let's first take a look at a video that IShowSpeed posted about everything that's going on.
Right now, I'm currently still in the hospital, and I'm hospitalized. I really just want to go home and stream for y'all. I want to go home, play Fortnite, play FIFA 24. I just want to go home and stream, but I don't know how long I'm gonna be here. Like I said, I am hospitalized. They can keep me in here for months, weeks, days, or years if they want to. I just did the MRI, whatever it's called, and right now I'm currently still doing this. Like I said, chat, I'm gonna tell y'all the symptoms. I'm gonna tell y'all the symptoms that I'm having. Basically, the symptoms that I'm having is like, this hurts. I'm having like a huge, it's like an ache right here and back here. So, and this is numb, and this part is numb. So I'm having numbness right here, and I'm having numbness back here, and it aches, like hurts, like a little headache.
So in this video, you can see that IShowSpeed's eyelid is clearly swollen shut. He also seems to be in a lot of pain, and that pain is unilateral, meaning it's only on one side. Now, when I first saw this video, I immediately thought of cluster headaches. Obviously, when we think about a differential, we try to start broadly and narrow in, but that is the first thing that came to my mind, as he does have some of the classic criteria. Now, the diagnostic criteria for cluster headaches, according to the International Classification of Headache Disorders, include 1, recurring severe headaches. So you must experience at least 5 headaches, each lasting from 15 minutes to 3 hours if untreated. Number 2 is unilateral pain. The pain is typically felt on one side of the head, and it's often centered around or behind the eye. This is a classic symptom that we're taught in medical school to look for when we're doing board exam questions. Number 3, there are autonomic symptoms. So during the headache attacks, you may experience 1 or more autonomic symptoms on the same side as the pain. So this could be eyelid redness, tearing, nasal congestion, or drooping of the eyelid. Number 4 is the frequency. So cluster headache, as the name describes, should be occurring in clusters, and this comes with periods of frequent attacks followed by periods of remission. The cluster period often can last several weeks to even months. And number 5 is exclusion of other causes. So it's very important to rule out other potential causes of headaches, such as migraine, tension, headaches, and there's other secondary causes that we'll talk about in just a bit. Now, IShowSpeed talks about getting an MRI, and this is important because when working up headaches, you definitely want to rule out the secondary causes such as tumors, abscesses, or anything else really that can be causing or explaining this pain and these headaches. Now, treatment options for cluster headaches aim to alleviate the pain, reduce the frequency and duration of attacks, and prevent future episodes. So if it's a first-time episode and you're currently experiencing a lot of pain, the first options are going to be geared specifically towards acute pain relief. First thing is oxygen therapy. Actually, inhaling pure oxygen through a mask can help relieve this pain, and so we're taught to give 100% O2 when someone is having a cluster headache. Additionally, you can use triptans. Now, these are medications that can help reduce the intensity or duration of the cluster headache. So sumatriptan is a very common medication for this. Also, dihydroergotamines. So these are administered as injections or can be administered as nasal spray, and this also can help relief during an episode. Less commonly used, but also possible, is lidocaine sprays or drops that can sometimes offer some relief. Now, if you're not in acute attack, you want to use preventative medicines. So verapamil is a calcium channel blocker often used for first-line prevention against cluster headaches. Also, lithium, which is also used as a mood stabilizer, can help prevent cluster headache attacks. Other possible preventative medicines include steroids. So sometimes you'll get short-term use of oral corticosteroids if you're in a long extended cluster period. And then there are other more advanced procedures that can be tried if it's very severe. So there's nerve stimulation. Sometimes there's occipital nerve stimulation, where you implant a device to actually stimulate the occipital nerve, which may help control cluster headaches. There's also lifestyle changes that are going to be important. So maintaining a regular sleep schedule, avoiding alcohol and smoking, which can or anything else you found that trigger your headaches, you definitely want to avoid. Alcohol and smoking just tend to be 2 common triggers. And that's why it's ultimately important, if you do suffer from cluster headaches, to potentially journal when you get them so you can start to figure out your triggers. It's also very stressful, as you can see in the video. IShowSpeed is very stressed. He keeps repeating that it feels like he's going to die. And this can be a very scary situation to happen to anyone, and a young person that's going through this for the first time. So I'm sending my absolute best to IShowSpeed. I hope you get better. I hope they figure out exactly what this is. If it's cluster headaches, sometimes some people only get it once, but in general, sometimes these are things that reoccur. So that's why we talked about both acute management and preventative. Again, wishing you a speedy recovery, and I hope this was educational to anyone else suffering with conditions like this.